South African Military Health Service towards military health excellence.
So autism is a developmental disorder that we tend to see in children, but because it's a pervasive developmental disorder, it will present even in adults, but it's a disorder that will have started in childhood. Typically it will present with abnormal language delay, so children who speak late or acquire their language milestones late, and also they have abnormal social interaction, typically aloof and not wanting to interact with other children, also presenting with abnormal repetitive behavior where they want to do the same thing over and over again. They're very fussy, typically very picky eaters, and just wanting to do the same thing over and over again. Most of the time associated with a lot of behavioral abnormalities like hyperactivity, very aggressive towards other people, and generally difficult behavior. So it's very difficult, having a child with autism, because as I've described some of the symptoms, the children acquire their milestones late, especially the language development, they speak late, and they tend to be very hyperactive, tend to be very difficult, especially in crowded places, tend not to interact well with other children. So they will experience difficulties at school, they will experience difficulties when they go to the mall, and even at home. So you find that most of the time the families struggle to handle the children because they're so hyperactive. Some of them don't sleep well, most of them actually don't sleep well at night. They're very fussy eaters. So what usually happens is that if the parents don't understand the temperament or the behavior of the child, the parents start fighting amongst themselves because they believe one parent maybe is not disciplining the child properly, and especially if the parents don't agree on a method of disciplining or handling the child, or if one of the parents is in denial, or both of them, for example, they tend also to be reactive and be aggressive towards the child and not understand the child's behavior. So it's a challenge in the military because, yes, we are not area bound, but you will understand that the autistic children, for example, they require involvement of healthcare workers. They require multidisciplinary team interventions. So they come to the hospital quite often. So someone has to bring them to the hospital quite regularly. So that becomes a challenge for the employer when the child is to be brought to the hospital quite frequently. So especially when the member is deployed, someone in the family has to bring the child to the hospital for regular follow-up and therapy, collection of medication. So that becomes a challenge, and when the parent is deployed, the children end up not receiving the care that is required. Also, the children, those that require special schools, or what we call learners with special educational needs, there are very few schools that cater for children with autism in the country. So once a child is placed in a school in Pretoria, for example, and the parents have to relocate to another province, it becomes very difficult to find a school, because most of the schools in government, there's a waiting period of about 3 years. So if the parent has to relocate, it's a challenge for them to find a school where they are relocating to. So it is a challenge for military personnel when they have children with autism. So we have adequate resources, but the challenge is that over the years we have noticed that we are getting more and more children with autism. So we do have pediatricians, and in Cape Town we have a pediatric developmental specialist, and here we have a pediatric neurologist, we have pediatricians, we have social workers, psychologists, occupational therapists, audiologists, and social workers, and psychiatrists as well, because the spectrum of autism is not just in children. The same children also grow up to be adults with autism. So we have to manage them across the different age groups, even though, the adults will have joined the system as people with autism, they still present with psychiatric problems like depression and anxiety and social isolation. So yes, we do have the right resources, but we require more resources because there seems to be an increasing incidence of autism worldwide. And currently, we are looking at getting our own educational psychologist in the military, because that will help us to assess our children timeously so that we can place them in the right schools. And that is a conversation we have had with Level 2, that we acquire the services of an educational psychologist for the military who will help us with the correct assessment of the children and their educational needs, and therefore place them in the correct schools. So the misconceptions are things like the child is hyperactive or aggressive because of ill discipline. That's actually not the case. Or people believe that the child must actually be isolated and put in a corner or locked up at home and not engage with other people. Those are the main misconceptions. But also one that we see quite often is people believing that the child will outgrow the autism and therefore not seeking medical attention very early, because unfortunately, if the patients or the parents wait, the longer the wait, the poorer the outcome is for the child. So we want to see the children very early. So what we would encourage parents would be that as soon as they notice something or they're worried, they mustn't trivialize it and think this is not important. They must come and seek medical help. I know sometimes people think we like to overdiagnose, but we don't necessarily diagnose very early. We would rather say to the parent, we note your concerns. We are also concerned about 1, 2, 3. It's too early to make a diagnosis, but let's treat what we are seeing and see how the child evolves and progresses. So essentially, it's better to start things like occupational therapy and speech therapy very early instead of waiting, because when one waits, we miss out on that window of intervention where therapy is most effective, and that is before 5 years of age. So essentially, the message would be, if you're worried, just bring the child to the hospital or take the child to the sick bay for assessment and get a referral letter. We see early, we intervene early. To be more involved and improve communication. Let's not hide our autistic children. Let's talk about autism, because the more we talk about it, and we get to realize actually that there is so much autism out there, and we can support each other and be more inclusive and create a better community for our children and improve the outcomes for our children. Because the more we talk about it, the more we realize that we have to invest in resources for our children who are autistic. Because like I've stated, there aren't enough schools for autistic children. Maybe we might move to a point where we even have our own military schools, or we have more resources put into the schools that are in the military areas so that we can help our children better.
South African Military Health Service, towards military health excellence.